You're recording.
Thank you, ma'am. Appreciate it.
Mm-hmm.
All right, everyone. We're going to get started. We had some technology issues, so we're not going to be recording through Panopto today. Thanks to Sally Ann for her help. We're just going to use an old-fashioned video recorder. So what we're going to do first is start with this game Kahoot, and I have about 15 questions on Kahoot, and what I did is I went to the real exam and I took questions off the real exam. Now they're not exact questions, but they're pretty similar, so that will give you an idea of kind of how practiced you are at this point in time and how much you need to continue to study. But I also wanted to talk a little bit about the exam. I sent you an email about the content of the exam, so it's going to have 40 questions that are multiple choice, and then it will have 5 questions that are short answer. And so what I did is I just went to the exam review and I copied a sentence from the exam review and I pasted it into the short answers. So you have all the material that you need to prepare for the test. The hardest part that students have in the past is basically just recalling the information. I mean, it's hard, like it may ask what forms of malnutrition were discussed in the modules, and you're going to have to remember these strange terms like marasmus and kwashiorkor. So that's what students have a really hard time with, is just remembering, okay, thiamine, what deficiency is that? Oh, beriberi. So it's just hard to recall some of it because it's not multiple choice, it's some short answer. But when you get into your senior level classes, a lot of the exams are short answer, or they're these multiple choice with like 60 answers and 20 multiple choice or matching questions. So it's real important to be able to recall information, especially when you get into your profession. So we're going to talk more about why all this is important as we go along. So let's go ahead and start this game. This is the first time I've done this, but I thought it would be fun. Let's hope it works, unlike the Panopto. So I'm going to click start, and what I did is I set it to have 60 seconds between questions, just like a normal test. Yes, ma'am?
I'm sorry, I was just going to ask about the test, like, is it...
Oh, sure.
Is it through D2L, like, is it the same...
She wants to know if it's through D2L. Yes. So when you come to the computer center, the Info Lab 1, all you do is you find a computer, you log into D2L, you click on quizzes. I don't know how you're accessing the quiz. Maybe you do it through the calendar or whatever. You find the midterm exam. The only difference is going to be I'm going to have a passcode to give you to access the test. And then you access the test and you have 60 minutes to take the test, and you can go forward, you can go backwards, you can skip some, do some more down the line, then come back, because it's not timed, and you know how the regular quizzes are timed and you have to really hurry up, and we do that because we don't want you looking up answers in the textbook. But because this is proctored, in a way it's good because then you have more time, you're not rushed through it. So it should take you only about 50 to 60 minutes to do the test. And ideally you want to, like for example, on Thursday it's 3 to 5. So if you come at 3, you'll finish at 4. If you come at 4:30 though, then that's going to cut you off short. And I think that Info Lab's pretty popular, so I would hate to be kicked out and you only have 30 minutes. So please plan to come and give yourself a whole 60 minutes between those 2 time slots, 3 to 5 and on Thursday and 9 to 11 on Friday. But you're not going to take 2 hours on the test. It's not a 2-hour long test. Any other questions about the test? Okay, so here we go. We're going to start, and then you guys are going to pick which one you feel is the best answer, and then we'll go over Okay, are you ready? Looks like it's getting ready. Okay, so a meta-analysis study is either a published article that reviews multiple studies, combines findings from multiple studies using statistical methods, compares and contrasts treatments and placebos, pairs alike subjects, studies response to a treatment. What do you think it is? So I wonder what would happen. Do I really have to wait and have y'all answered? So I guess after the 30 seconds or whatever, 18, 17, it'll go on. I wonder what would happen if I click next. All right, so 5 of you believed it was combines findings from multiple studies using statistics, and that's correct. So meta-analysis, basically what it does is it looks at all of the research, peer-reviewed research articles that have been done in the past, and then they take all those numbers from those peer-reviewed research articles and they reanalyze them in different ways. So that's what a meta-analysis is. So on one of the modules you have, it takes you to the Cancer Institute website, and you had to go through that video. Just be sure and remember all of that, because it's real important to understand the difference between all of these studies. And if we have time towards the end, we'll talk about the research paper too. All right, so good. Next. What do the mucosal cells in the stomach produce to protect it from autodigestion? Oh, I'm supposed to read them out. Okay, mucus, enzymes, chyme, or bolus? All right, good. It's mucus, because mucus protects the stomach from the hydrochloric acid. And what is chyme?
Chyme, isn't it like all the juice and stuff, like when it's mixed together?
It's the
Yeah.
food and the juice all mixed together. Bolus just is the method of how you're eating. We bolus every day when we eat because we eat large amounts and then have time span in between. So bolus is just the big food that comes down into our esophagus, then it turns into chyme once it's mixed. And then enzymes help digest. So very good. What is the function of gastrin? Does it stimulate the pancreas to secrete bicarbonate? Does it stimulate stomach glands to secrete HCl or hydrochloric acid? Does it stimulate the gallbladder to secrete bile, or does it stimulate the pancreas to secrete enzymes? So think about gastrin, that root word gast, and that'll help you answer the question. All right, so it is stimulates stomach glands to secrete hydrochloric acid. So gastrin is a hormone that's associated with the stomach, and what's the scientific term for stomach?
Gastro.
Gastro, or gastric cavity. So that's how you can remember that. So there's a list in the book that goes over all the hormones like cholecystokinin and all these different hormones and what their function is, so just be sure and recognize those. I know that working with people with eating disorders, cholecystokinin is a hormone that's secreted. It's secreted when your stomach expands, and it's supposed to tell you when you're full, and people who have bulimia will actually eat to where they're so full and their stomach is so distended the cholecystokinin, there's less of it that goes to the brain. They lose that effectiveness to feel full. So it's kind of interesting. Yes,
Dr.
ma'am.
Dwyer, is that the one that's CCK?
CCK, yes. What molecules are synthesized from exogenous fat? Whoops. Directly after a meal. So first of all, you have to know that word exogenous. What does that mean? Out, right. Very good. So food that's coming from outside, it's coming from outside of the body. So that means you're eating fat. And what does your body do? What molecules are synthesized from this fat? Oh, I forget. We're videoing this. So it's LDL, triglycerides, HDL, or chylomicrons. And actually, nobody picked it. It's chylomicrons because triglycerides, LDL, and HDL are all produced from endogenous fat. Endogenous fat is fat that your body makes. So when you eat a meal, your fat that's from that meal is going to first form into what? It starts with an M.
Micelles?
Right, micelles, because fat is not water soluble and the cells are, so they have to form into micelles first just to even get inside the cell. And then the cell builds the chylomicrons, and the chylomicrons go into the lymphatic system, and then they don't go into the portal system, or they're released out into the portal vein until they reach that big, they have to reach this big artery, because chylomicrons are so big there's no way they can go in the systemic circulation. And then once they get into the circulation, they circle around and the fat cells remove fat from the chylomicrons, and then it's the liver that produces LDL and HDL from endogenous fat. So triglycerides are kind of what you measure after a meal, and those chylomicrons are all floating around, and then they turn into IDL, intermediate. And then that's why it's so important when you are getting your triglycerides measured and any kind of lipid panel that you're fasting. Because your triglycerides go way up after everybody's does after they eat. So you really have to fast to truly know what your triglyceride levels are. So this is a hard concept, so just be sure and understand the difference between LDL. Which one do you want in terms of HDL, LDL, or triglycerides? Which ones do you want the most of?
HDL.
HDL. So you can remember that by healthy HDL and LDL's lousy LDL. So you want more HDL. And what's interesting is, it's funny, 20 years ago they only measured cholesterol, and then they learned, okay, well there's more to cholesterol than just cholesterol. We need to fractionate it into LDL, HDL. We need to measure triglycerides, and now they're fractionating it into further compounds. There's like 6 different LDLs now, and there's LDL type 1, 2, 2A, all these different kinds. So there's LDL matters too. There's good LDL and there's bad LDL, so you'll learn all about that maybe when you get into graduate school, but it's really interesting how science progresses. So be sure to understand kind of how fat is absorbed and carried through the system. It makes a big impact on disease states. Oh, I'm going to keep going. Okay, so what's true about a micelle? Micelles flow into the lymphatic system. Micelles are emulsified droplets of fat. Micelles are lipoprotein carriers, or micelles go directly into the bloodstream. Okay, so looks like y'all were a little bit confused about that one. But micelles, those, when you eat exogenous fat, so if you ate a pizza, the fat from the pizza is going to enter into your stomach, then your small intestine. And remember, it is not water soluble. So there has to be some way to get it into the cell, emulsify it to where it can stay in that aqueous cell environment. So it forms a micelle. So micelle is the first thing that happens for a cell to absorb, for a lipid particle to absorb into the cell. And then what happens once the micelle is absorbed into the cell? What molecule is formed? Chylomicrons, right. Then the chylomicrons travel through the lymphatic system. They're dumped out into the systemic circulation. They go around and the cells take all those wonderful high energy triglycerides. What's left goes to the liver, and then the liver is responsible for packaging it into HDL or LDL. LDL then distributes it again to the cells, and then HDL picks up all the cholesterol that's not used, takes it back to the liver, and that's why HDL is so good, because it's removing cholesterol out of the bloodstream and taking it to the liver. It's very complicated, but that's kind of the basic thing. Alright, so clear on that? The fat's kind of hard, isn't it? Okay, medium chain fatty acids are unique because they travel through the lymphatic system, don't require micelle formation for absorption. They're all unsaturated, or they are packaged into HDL for transport. Good. They do not require micelle formation for absorption. So they don't go through the lymphatic system. They go straight into the bloodstream to be used as quick energy. And this is important because when I practiced as a dietitian in pediatrics, we would have kids that had liver disease. If they have liver disease, they're not producing the necessary lipoprotein transporters that are required to transport all this fat. And so their liver isn't producing bile either. So they would have a lot of fat malabsorption issues. So we would give them formulas that were really high in MCT oil. We had a formula called Portogen, which was 85% MCT oil. But why couldn't it be 100% MCT oil?
Cause some diarrhea probably. Don't know.
Good answer. So the formula had to be 85% medium chain triglycerides. So that means that didn't have to have bile for absorption, didn't have to be packaged in the chylomicrons. It just went straight into the systemic circulation. The rest of the fat, the 15%, had to be long-chain triglycerides. So what is an essential long-chain triglyceride? And there's two of them, and it starts with an L, both do. Linoleic and linolenic. Remember those? So if you had 100% MCT oil and you had a baby on Portogen that was meeting 100% of their protein and energy needs, they would develop an essential fatty acid deficiency really quick. So the formula company has to add some long-chain triglycerides to meet that essential fatty acid requirements. Isn't that interesting? So this is why dietitians need to learn all this stuff, and nutritionists too. Because if you're working at WIC as a nutritionist, you're going to encounter all these unique formulas. I think nutritionists are awesome. Okay, next. What is the form of vitamin B12? Is it cobalamin, megalamin, pyridoxine, or coferol? Alright, it's cobalamin. So why is this important? Why can't we just call it B12? Why do you have to remember some scientific name? Well, on almost all of the supplements, it's cobalamin. And what's interesting is there's different forms of cobalamin. And this is very important because I have patients who have genetic defects that can't convert, like cyanocobalamin is the cheapest form of B12. It's what you're going to find in Women's Day supplements. It's going to say cyanocobalamin, and it's very, very cheap. They actually use a cyanide molecule to make it, which isn't an issue. It doesn't poison anybody. But there's some people that can't convert cyanocobalamin to the active form, which is methylcobalamin. So methylcobalamin is an active form of B12, and that's what a really high-end supplement's going to contain, because if you don't know that you have this genetic defect and you can't convert it, then you might want to take something called methylcobalamin. So it's real important to know the scientific names of the vitamins, because you can't just, you don't say cyano B12, and so that's the scientific name of B12, and like B6 is pyridoxine, so there's an activated form of B6 called PLP, or pyridoxine L-phosphate. So it's really important to know the scientific names of all the vitamins. Okay, next. The liver, kidneys, and skin are all required to synthesize this vitamin. Is it vitamin C, vitamin E, vitamin D, or vitamin B12? All right, good job. So vitamin C we can't make at all. The only thing that can make vitamin, the only mammal, is guinea pig a mammal? The only mammals that can make vitamin C are guinea pigs.
They're good for something.
It's been a long time since I've had zoology. So yeah, guinea pigs are good for something, so we have to get vitamin C in our diet. Vitamin B12 can be made from gut bacteria, a little bit of it, but not a whole lot, so it's hard. What population has issues with vitamin B12 deficiency?
Vegetarians.
Vegetarians and vegans can have issues. Now we have vitamin B12 is stored in the liver, so we have about 5 years. And that's important to know too, because like I worked in the hospital and we had people that had cancer, or maybe they were in a car accident, or maybe they had bariatric surgery, and some of them lost their ileum, which is the part of the intestinal tract that B12 is, most of it's absorbed, especially around the ileocecal valve that separates the ileum from the colon. And we would say, oh, we've got 5 years to deal with this, because we would just monitor. They could take serum B12 levels and follow them to make sure, but really we would start them on a B12 supplement at that time. And I deal with B12 deficiency a lot. I see it a lot. I have patients that have pernicious anemia, and in pernicious anemia what happens is their immune system attacks the parietal cells and the cells that make intrinsic factor in their stomach. Y'all remember what intrinsic factor is? It's made in the stomach, it binds to B12, and it's the only way we can absorb B12. So this is why it's important. I want y'all to know why, because you will see this if you end up in medical school, pharmacy school, registered dietitians. You're going to see all this again, so it's not, I don't want y'all to think, oh, I'm so sick of having to memorize all this, but it really is important. And the doctor that I worked for a few months ago came up and said, oh my gosh, we've got somebody, I think they have pernicious anemia. Can you look up how we can diagnose this person? And I remembered from school the Schilling's test. But I told him, well, I'm going to have to look that up. Well, they're not using the Schilling's test anymore. They're using antibodies to the immunoglobulins, the parietal cells, and intrinsic factors. So that's what we did. But just imagine if he'd come to me and said, so they have pernicious anemia, and what if I didn't know what that was? So it's real important for us to understand anything that's related to vitamins and minerals and digestion and absorption. It's our duty to know and learn it as best we can, because that's our job. So the book has some really interesting, it's pretty interesting to read, and so y'all might want to keep the book for future references. Okay, next, the purpose of the angiotensin is to dilate blood vessels, conserve sodium, constrict blood vessels, reduce sodium, or reduce blood pressure, sorry. Okay, so angiotensin is, the purpose is to constrict blood vessels. Who's had physiology?
I'm in it right now.
All right, good. So do y'all remember the RAS system, R-A-A-S? Yeah. So that's real important to understand the RAS system, and that's in the study guide. So be sure the renin, angiotensin, aldosterone system. And then when you get into, if some of you go on to medical nutrition therapy, you'll learn what nutrients impact blood pressure, like magnesium and potassium. It's interesting because there's a lot of controversy right now about sodium's impact on blood pressure. There's new studies coming out showing that low sodium is just as bad as high sodium, and the main issues with blood pressure is where we don't get enough potassium. And where do you find potassium?
Bananas.
Good.
Oranges.
Bananas, orange fruits, vegetables, lots of fruits and vegetables, potatoes, avocados, bananas, apricots. So you'll learn more about that too when we talk about kidney disease. People who have kidney disease have to be, a lot of them have to be on low potassium diets, because the kidneys are responsible of getting rid of excess potassium. And you'll learn all about foods that contain potassium that are low and high. And then a lot of the medications to treat blood pressure block this conversion of angiotensin so that you can have dilation. They're called ACE inhibitors, angiotensin converting enzyme.
Now we know what that means.
Isn't that awesome?
Yeah.
So in M&T, that you'll really go in depth with all of that for those of you who's registered dietitian track and pre-professional track. Okay, so you just get to learn it for the excitement of learning.
I have to take this class for pre-admission assistant.
Oh, super. Is it on your degree plan?
Yes.
Wow. Well, that's exciting. I remember I emailed you because I was wondering, so you're biology and pre-physician assistant. So that's great. I had no idea somebody put this on their degree plan, so I hope you're going to get a lot out of it and have positive things to say. Okay, next. Which mineral is least likely to be deficient in a person's diet? Zinc, calcium, selenium, or phosphorus? This came straight out of the quiz. I bet some of y'all remember it from one of the quizzes. So it's phosphorus, right? So zinc, boy, zinc deficiency happens quite often, and I saw it a lot in pediatrics. People who had really bad diarrhea could develop a zinc deficiency pretty quickly. So you also see it in conditions where you're having malabsorption, like Crohn's disease or ulcerative colitis. And then calcium deficiency is quite common. In fact, I've been seeing some bariatric patients, and all the bariatric patients have to have calcium citrate at least 1,000 milligrams a day. Now with calcium, we know based on absorption that only 500 milligrams can be absorbed at a time. So we tell the patients, you need to take calcium citrate in the morning and you need to take calcium citrate in the evening. Split the dose. And then also, we recommend the citrate form because citrate doesn't require as much stomach acid for absorption, and people who've had bariatric surgery has lost a great deal of the stomach. And stomach acid is required for the absorption of a lot of vitamins and minerals. So calcium carbonate would not be absorbed if they took calcium carbonate. So that's just another example of how important it is to know the nutrient and the different forms. Alright, next, what is the most predominant antioxidant? Vitamin D and vitamin E, beta carotene and B12, vitamin E and selenium,